My name is Jaquelina Rousselot with EliteHealth Medical and Wellness Center. And today we are going to talk about Medicare. And when we talk about Medicare, it's not easy to understand. We turn 65, we are bombarded by emails, phone calls, mails with choices. To make clear what is Medicare, I have the pleasure to introduce the Director of Florida Senior Care Partner, Jamal, and thank you so much for being here.
Thank you, Jacqueline.
How are you?
I'm very well, thank you.
Okay, so please help us to understand what is Medicare. We turn 65 and we receive that red, white, and blue card. What is the next step?
Well, first of all, thanks a lot for having me here and to try to assist with disseminating some simple information to all of those who are in need of it. As Jacqueline said, my name is Jamal from the Florida Senior Care Partners. The question is that when we get Medicare, that red, white, and blue card, then what happens next? Well, as a matter of fact, before we actually get that red, white, and blue card, there is some work that really should be done. And first of all, people get Medicare based on a couple of reasons. First of all, when we have worked and paid our taxes in this country for at least 10 years and become age 65, we qualify for Medicare.
Exactly.
Some people will get Medicare younger than age 65 if they have been disabled for at least 24 months, so that you do not necessarily have to be age 65. So when we have qualified for Medicare, we qualify for parts A and B. Part A
and B, that's
Yes.
right. I'm sorry, I didn't mean to interrupt, but you said that we have to do something before we turn 65?
Well, yes, and I'll come back to that
Okay,
in just a minute. We get part A and the part B. Now, this part B required, for the part A, we do not have to pay a monthly premium.
Mm-hmm.
For the part B, we have to pay a monthly premium, and that's where a lot of folks, they become confused.
Exactly.
And you may find that there are a number of people who do not have Part B, and it's because they were quite confused at the time they were getting their Part B. So here's the thing, before you get your Medicare, everyone needs to be aware that when they're becoming age 65, that's the next thing is going to happen. They'll qualify for Medicare. I always advise everyone that at least 3 months prior to becoming age 65, call the Social Security office.
Okay, that's great to know.
And make sure that the information that they have there for you is correct.
I
That
see.
your name is spelled correctly, your date of birth is correct, and your address is correct.
Mm-hmm.
Quite often, people would have changed their addresses and their Medicare card can go to a wrong address. If your name is misspelled on that card, it can have some problems.
Simple like that.
Very simple things.
Okay.
And sometimes, the system is the system, whatever it is. And there is always a little flaw here or there somewhere or the other. And you might just happen to be that person that falls in that crack.
And one question, Jamal. So I turned 65 3 months prior. I contact Social Security. What do you suggest to do? Go to the office?
Call them.
Okay.
Call them. There is a number that you can call, 1-800-772-1213. You call that number, and it will take a little time sometimes. It depends on the time of the day. And you just let them know that you're calling to verify my information, because
exactly.
I'm going to be coming age 65 soon. I want to make sure everything is fine, correct? So that is very, very important.
That helps a lot, because then you have to wait another time if it's any wrong information in Social Security.
Exactly.
Okay.
Exactly. So that is something that needs to be done so that you will be able to get that Medicare card before your actual month of commencement for your Medicare. So if your birthday is in June, then you should have contacted Medicare at least, when is it? April, May, June. least April to make sure everything is fine,
Okay,
and so
excellent.
on. So they will send you your card. Now that Part B business there, a lot of people, when they're told that they have to pay a monthly premium for Part B, especially a person whose social security, many people are just living on social security income now.
And they have that surprise that suddenly they see less in
That's
their check
right.
and they don't know what is going on. And how much is that amount?
It's right now it's $144.
Exactly, it's a big difference.
It is a big deal for many people. It's a big deal. And so a person would decide, quite often I've seen them decide, well, I need that $144 more than this Part B stuff. And they don't really understand what are benefits and so on with this Part B and things like that. So that, like I said, the Medicare Part A, which we do not, has been paid for because of the taxes that we paid during the years we worked. And we do not have to pay a monthly premium after we become age 65 for the Medicare. But the Part B, that $144, what actually happens is Medicare takes that money, I'll put it in simple language, that $144 that we all pay, all the people who have Medicare, that $144 Medicare takes it and put it into a huge pot. Imagine you have a pot on your stove, and in that pot that's cooking, it's all of that $144 that everybody is putting there.
Exactly.
So I'll tell you in a minute what happens with that money that's in there.
Oh, tell me, please. I want to know.
Right, that pot. That's a very, very important pot. Now, if you looked on your Medicare card, you will see that it's got just Part A and Part B.
Exactly.
Hospital and medical. Hospital covers every single thing that you will ever need while you are hospitalized.
Totally, 100%?
100% after you have paid that first copayment, that deductible that you have to pay, which is $1,100 and something dollars.
Exactly.
Right? You have to pay that, and then everything else, Medicare pays that. And if you stayed in hospital longer than 30 days, it's about $250 something per day. And then if you stayed longer than 60 days, it's another large sum of money that you have to pay for that again. So that by that you can see that a stay in hospital can wind up costing a few bucks.
Exactly.
And I'm sure you may have heard many people who have incurred those costs.
I'm very concerned. So there are choices, there are options that can help to cover that 20% and the deductible?
Yes, I'll come to that in a quick minute here. So that the Part B covers your medical expenses, such as doctor's visits and
Elite.
diagnostic, yes, like EliteHealth Center.
Exactly.
Diagnostic testing and stuff like that and what have you. Medicare pays 80% of the Medicare approved amount. That's important to note. Because,
that's good to know.
Let me explain that to you. If you went to the doctor's office and the doctor charged you, let's say $100, I'm going to use round figures, and when they have sent their invoices and so on up for reimbursement to Medicare, Medicare says, no, we consider this an $80 procedure. So Medicare will pay that doctor's office 80% of $80, not 80% of $100. So what happens is the difference between that $80 and $100 is what the patient will have to pay.
Exactly.
So quite often when people get that bill, they are very upset and confused and don't know why they're getting a bill. Because I have Medicare, and Medicare is supposed to pay this.
So what we do in that case? Could you help us to understand what choices we have?
Well, okay, I'll come back to that in a minute.
I'm sorry. I'm so
No, it's all right. No, keep asking me because you're reminding me. Then you see on the Medicare card, there is no Part D.
I know.
Part D is where we get our prescription drugs.
Exactly.
Medicare does not cover prescription drugs unless you purchase that Part D, which on the average can run you about $40 per month. So the $144 for Part B plus that $40 for Part D is going to run you about $180 per month that you have to pay in order to get your hospital, medical, and the
And the
prescriptions.
prescription. So Jamal, we
So
need
now-
your help now to see how we can cope.
Let's see how we can get around all of this.
Absolutely.
We have the most common plan that everyone uses and should really be looking at, especially in these days of conservation, is a plan that's known as a Medicare Advantage plan. And there's a reason why it's called Medicare Advantage, because it just gives you it pays for everything that Medicare does not
Oh, that is a peace of
pay,
mind.
such as the 20% and all of those different co-payments. However, the Medicare Advantage plan is a plan that has been contracted to provide the services that Medicare normally provides. So that, for instance, things like dental and vision and hearing and so on, which are benefits that's not necessarily provided by Medicare, the Medicare Advantage plan offers those benefits as called added benefits.
That's great.
You see, so that if you get a hold of someone who is a Medicare Advantage plan's representative, then they will be able to guide you along and tell you what the different benefits of that particular plan is. It's always wise to contact someone who, and I like EliteHealth Center works with brokers who represent several different plans, because this insurance is not a one plan benefits all.
Exactly. That is a good point, Jamal, because here in Elite Health, when we have patients asking for the Medicare Advantage plan, in Elite Health, we accept the main Medicare Advantage plans because we know that it's an excellent coordination for our patients. So what we do is, as soon as we know the needs from the patients, we contact you, a broker, an advisor, and they have the one-on-one meeting so you can explain based on their needs what is the right plan.
It's always very important that the broker does what's called a needs analysis.
Needs analysis.
Because you may have one type of need, I'll have a different type of need, and so on and so forth. And then what happens? Sometimes, let's say, a person loves EliteHealth Center. They have been recommended by a relative or a friend, so they want to come here. Then the insurance plan that they have, the Medicare Advantage plan that they have, may not be one of those plans that EliteHealth Center works with. Then what happens? Does it mean that they cannot come here any longer? No, it does not mean that. You call a guy like me, and we talk to them, and we discuss and see what their needs are, and fit them with one of the plans that that offer the better benefits that Elite accepts, and then they will be able to now get the quality of healthcare that they're looking for, that they need to have.
And also in the future, as soon as you recommend the plan, they can contact you. They can always keep the assistance of you, an advisor like you with a license in health insurance, in order to continue with the coordination of all the plans. Because I understand there are different times in the year that you can change the plan.
Yes, certainly. Well, one of the things I always tell all of my patients, man, woman, or child, whoever it is, that when you have enrolled in a plan with me, what you've automatically done is you've become married to me. Because
look at that.
Because I'm here with you, for you, whenever you have a need or a concern. Please feel free to call me. I'm always here for you. I give everyone my phone number. You can call me at any time, right? And
that
my
is
email
a great help,
address
especially
as
for
well.
the seniors.
So that you can call me, and I'll try to help you. Sometimes a patient may have a little bit of a complicated need where we have to sort of guide them. Maybe we will even call the plan themselves with a conference call with the customer service and try to help them to get their matter resolved. But this is a place like EliteHealth Center. I have found that the patients from Elite Health Center, their needs are more often than not satisfied right here at the center. The girls are always able to take care of those needs for
Okay.
them. And whenever there's a little bit of a matter that they need, they will call me and they say, Jamal, so, and we take care of it and it's done.
Exactly. It's a perfect coordination in between the doctors, you as an advisor,
It's
and
got to be a coordinated
coordinator.
effort. It's
That's
got to be
great.
a coordinated effort.
And Jamal, so if we want to talk to you, we want to call you. What is the number to contact you?
Now, my phone number is 786 263 1288. My email address is F as in Frank, S as in Sam, C as in Charlie, P as in Peter, USA@gmail.com.
That's great to know.
Get a hold of me there anytime, and you can call me anytime. I have been in this business for a little over 20 years. I currently represent more than about 12 different Medicare Advantage plans, so that the chances are very likely that I will be able to fit you with the correct plan for your particular needs.
Thank you so much, Jamal, for this information to make easy for us to understand, to make Medicare clear for us. But you can contact, I'm pretty sure the community that is listening now, they are very grateful to have your information. And again, we are Elite Medical Center. We are all about you. And you can call me as well. My name is Jaquelina Rousselot. My phone number is 786-583-5411. Have a wonderful day.